Remember to comment below if you want more videos about one specific topic, and don't forget to subscribe to the channel. Treatment options for female hair loss. If you're suffering from hair loss, there are things that you may be able to do to get treatment for your issue. But the very first thing you should do is talk to your doctor about it. Sometimes doctors will shrug off hair loss issues, but you need to advocate for yourself and ask for blood tests that can rule out underlying conditions. The only exception is if you're losing your hair for a known reason, such as chemotherapy. In that case, there may be things your doctor can recommend, but you may have to just stick it out until the treatment is over and your hair will grow back. Diet and exercise. Hair loss that is happening due to nutritional deficits can be addressed via diet and exercise. The reason diet is so important is that you can lose your hair if you're not getting the right micronutrients. Exercise is important because it helps with circulation and blood flow. Scalp massage. Anyone who is suffering from thinning hair can benefit from scalp massage. Go to a professional who knows what they're doing to ensure they don't cause any damage to your head. But massage will bring more blood to the area, causing the follicles to grow more hair. Better styling techniques. If you're overstyling your hair, using a lot of chemicals, tight braids, hair extensions, hot irons, and styling products, you can cause your hair to start breaking off and it will look as if you're suffering hair loss. Try to be gentler with your hair and use more natural products and solutions. Using the right hair products. Hair products don't have to be expensive, but for some people, it's imperative that they pay attention to which ones they're using. If you have fine hair, use shampoo for fine hair. You don't want to weigh your hair down and cover your scalp with so much product that it cannot breathe. Vitamins and supplements. If you're suffering from any type of nutritional deficiency, supplementation can help. This is especially true if you're suffering from a deficit in your iron or B vitamins. Check with your healthcare professional before adding supplements. Laser light treatments. Some people have seen some results from specialized laser light treatments at their dermatologist. Most people think of this type of light as taking hair away, but there are treatments that help you grow hair too. Link: https://amazon.to/2inks0me. Prescription tropical treatments. There are a few choices your doctor can give you to help you deal with hair loss. These are products like Latisse, Rogaine, Floridil, and Nizoral. Do not take any prescriptions for hair loss without studying their potential side effects, though. Prescription drugs. There are also pills that you can take that help with hair loss. Most are only used in males, though, with the main one being Propecia, which is what President Trump takes. They still don't have a pill especially for women. Surgery. While only a small portion of women have the right type of hair loss that surgery may help with, it is still a possibility. It's usually very effective when you follow the doctor's recommendations for care after the very painful surgery. No matter what treatment you choose, remember that if you don't know why you're losing your hair, you need medical intervention. Only a doctor can diagnose what is happening. Be your own health advocate so that you can get the treatment you need. What are the signs of hair loss in women? The best way for women to fight hair loss is to notice it when it first starts happening so that you can identify the cause and treat the cause when possible. Let's look at a few signs that your hair may be thinning for you to pay attention to. Your part is getting wider. If you part your hair, notice whether the part is getting wider or not. If you're not sure, consider measuring it so that you can check it in a few months to see if there is an increase in the part size over time. You see more scalp when you pull back your hair. Most women experience hair loss different from men, but you may be able to tell if your hair is getting thinner when you pull it back. If you can't get the style right like you used to and can see more of your scalp, you may be losing your hair. Your hair is flatter than before. If you like to have a full hairstyle and you notice that you lack volume and your hair is looking a lot flatter than it used to even though you have the same style and use the same products, it could be that your hair is getting thinner. Your hair doesn't hold a style well. Are you finding it hard to get your hair to hold a style compared to in the past? It's possible that you cannot carry that style anymore due to thinner hair. Consider getting a new style, but also consider that your hair is thinner, so you may want to speak to your doctor about it. You see more hair on your pillow in the morning. Each morning, check your pillow when you get up. If you have noticeably more hair on your pillow compared to before, it's possible your hair is falling out. Your scalp suffers burns easier. Do you notice that spending time outdoors causes pain and pinkness to your scalp more than it used to? Your hair normally protects your scalp. If it's not protecting it like it used to, then your hair may be thinning substantially. Your ponytail is smaller. If you often wear a ponytail and you notice your band falling out or that you must put it on tighter than you did before, even if you buy new bands the same as you had before, your hair is likely thinner. You're clogging your drain more than normal. Is your tub drain getting clogged more than it used to? If so, you may be losing a lot of hair in the bath or shower compared to what you used to lose. This could be a sign that your hair is falling out. You see more hair in your brush. When you brush your hair, do you see a lot more hair coming out with each brush than before? Don't stop brushing your hair. It's good for your scalp, but do talk to your doctor about how much hair you're losing so you can get a checkup to try to identify the reason. If you see any of these signs, don't panic. Your first stop should be your doctor to ask for a blood test to determine if you have an underlying health issue causing the problem. Your doctor will look at your medications as well to find out if you're taking something that has hair loss as a side effect.
I know that you like it like that. I wear designer, check the name on the tag. White fox fur on my jacket. Excuse me, that's a